Everyone, and welcome to today's live session. Today I'm going to talk to you about what exactly is spinal manipulation and also give you some exact demos about what exactly we do when we are doing spinal manipulation, because you've heard this term quite a bit. You have heard adjustment, you have heard spinal manipulation, but a lot of people feel, what exactly are we doing, what exactly happens when we are doing spinal manipulation. So that's what I'm going to talk to you about today. But before that, I would like to inform you that we are in Ahmedabad from tomorrow 11th to 14th of this month. We are in Ahmedabad. And if you are looking for appointments to see us in Ahmedabad, the number is 800-6738-000. That's the number, 800-6738-000. I will put this number in the comment. You can actually, yes, I hope you all can hear me. And yes, I have pinned the number, and if you're looking to see us in Ahmedabad, we are there for the next 4 days, that is Thursday to Saturday, 11th to 14th of July. And let's talk about spinal manipulation. So friends, this is how your spine looks. This is your skull, and this is how your spine looks. This is how it looks. Now if you see right here, this point, all of this, these points, these are called spinous processes, which you actually feel on the back of your spine. When you touch them, the point that you feel is actually this is the spinous process. Now this spinous process in a lot of places is actually twisted, or it is turned. For example, let's say here, if I have to show you, let me give you a close-up of this. Okay, so if I have to show you here, this one, this particular spine is like a little shifted. See, it is not exactly in line with the rest of the spine. So like we see, this is exactly not in line with the rest of the spine. Now here it is right, but then here there are issues. Okay, and the same thing happens when we are in the lower back area, right over here. This is the sacrum, this is the area where you sit, this is the tailbone area, down the tailbone. Okay, and this is where you get tailbone pain if you have issues. But then normally the most important cause for your back pain is the sacrum and the spinous processes which are rotated. So when we do the adjustments, we are actually getting these spinous processes right. We are actually getting them corrected. Okay, this is what happens in a spinal manipulation. And there are a lot of structures, like when you see here, because of this spinous process being rotated, you see the nerve here. This nerve gets compressed. Now because of this nerve getting compressed, the problem is you complain of pain. So this is where your pain comes. It is because of the compression of the nerve. Now why does the nerve gets compressed? That is because of this rotation of the spine. So this is what we correct. This is where we get the spinous process back to its place, so that the nerve compression is reduced, so that the pain is reduced. Okay, so this is about what I was trying to explain you about spinal manipulation. Okay, talking about these vertebrae, so we have about cervical vertebrae, we have 7 cervical vertebrae, 12 lumbar vertebrae, 12 thoracic vertebrae, and then you have 5 lumbar, and then sacrum and coccyx. So this is how the arrangement of all the lumbar spine is done. Now for example, let's take just two vertebrae coming from this area. You know, if we take a okay, I have some right, I hope this is stable for you all and you can see me easily. So let's say if we take 2 vertebrae out and try to understand what exactly happens between them. So this is how the 2 vertebrae will be. You know, we were looking at it from this side. This is the spinous process, and here when the rotation happens like this is how the nerve gets compressed. Okay, so what we do is we try to correct this rotation. Okay, and if you look at this side, this is where your disc is. So you see this movement, this is the movement that is available when you do forward bending, backward bending. All of this movement is, and this is your disc. So this exactly is the disc which actually gets compressed to some extent, or there can be, or it can actually leak from one of the sides, which is called a disc bulge. It presses on this nerve and that causes pain. Okay, so when you get the movement of the spine right, when you try to move the spine the right way, this is how it helps you to reduce your pain. So back pain can have multiple reasons, but these are some of the common reasons where you will see this issue. It could be either because of excessive rotation, which we called as subluxation. So you see here now, when I'm showing you from the sides, right here, the nerve is actually getting compressed, and this can easily cause back pain. Okay, so my job is to get this corrected. So I will try to improve the subluxation and try to do this movement so that the nerves are absolutely free from all the sides. Like you can see here, the nerves are absolutely free from all the sides, right? And then when we talk about this area, like this, like you can see the nerves coming from, and this is the movement, this is the disc. So this is what we are moving basically. So I hope you understand that spinal manipulation or adjustments, it's not just about creating sound or creating cracks. You need to understand at what level the spinal adjustment needs to be done. You need to understand what exactly are the tissues involved. You need to understand what sort of stiffness there is, and how, you know, even stretching can be one aspect which can be worked upon. And you also need to give the right sort of exercises to the patient, because just doing a movement is not enough to give you that sort of relief. Nutan has a question. Nutan is asking me, when are you coming to Mumbai? Nutan, we are based in Mumbai, and we are available in Mumbai every Saturday at Lower Parel as well as Thane. But the next availability for Mumbai is on 27th of July. If you're looking to see me in Thane, I will be available next week, because 11 to 14th we are again having a camp in Ahmedabad. So we will be in Ahmedabad from 11 to 14. Like you guys might be knowing that we do a lot of camp in other cities like Ahmedabad, Bangalore, Surat, Pune, Goa, all these places, and it has been more than 3 years now that we have been doing these camps, and we see these patients from a camp to camp basis. And I prefer that most of the patients should see me on day one itself. So if in case they need therapy, in case they need additional sessions, we can advise them and they can come within the next 2 or 3 days and try to cover therapy as much as possible, followed by the exercises. So guys, this was a little bit of demonstration as well as a description about what exactly spinal adjustment is, and what are the levels that we work on, what are the levels that we try to create the adjustment because of which your pain reduces. And of course, exercise has a very important role. Sham Agarwal has a question, when are you coming to Surat? I think Surat, we are in the end of August, we'll be in Surat. So yes, we will definitely inform you in the first week of August about the appointments. But yeah, end of August, we are in Surat. Right. So if you guys have any question, you can definitely put up your questions. I'll be more than happy to answer your questions. Whether it is related to your joint pain, whether it is related anything to your camp information, anything that you want to ask me. And I would like to inform you once again that we are this week, that is from 11th to 14th of July, we are available in Ahmedabad for our 10th or 11th camp, probably in Ahmedabad. And yes, you can take up the appointment on the number given below. I have pinned the number in the comment section, so it becomes easy for you to identify, and you can take the appointment directly from there. I think we have our day 1, 2 is booked, so you have a few slots left for day 3, so you can check, call upon, and definitely see me for your back pain, joint pain, or shoulder issues, frozen shoulder, sciatica, disc issues, all of these conditions in which spinal manipulation helps, and it plays a very crucial role. So thank you very much guys for joining the live session and watching the video. Make sure you share this video with people who may need it, so that they can also refer, or they can also help the patients get this kind of therapy. Thank you so much, and looking forward to see you all in Ahmedabad.